Let's discuss heart patterns, phlegm misting the heart orifices. Concept, it is in this pattern, the heart is misted by the phlegm, leading to disturbance of the mind. Clinical manifestation, various mental derangement such as depressive psychosis, epilepsy, or syncope, sudden unconsciousness disorders. Letter A, depressive psychosis, depression, apathy, dementia, soliloquy, abnormal behavior with a greasy tongue coating and slippery pulse. Letter B, epilepsy, there is a sudden fainting, loss of consciousness, drooling, a gurgling sound in throat, convulsions, upward staring of the eyes, shouting which sounds like a pig or a sheep, then returning quickly to a normal condition after awaking, with a greasy tongue coating and a slippery pulse. Letter C, phlegm syncope, a sallow complexion, fullness in the epigastrium and chest oppression, nausea, vomiting, cloudy consciousness, mental confusion, glossolalia, non-meaningful speech, or a rattling sound in the throat, and even loss of consciousness and fainting with a white and greasy coating and a slippery pulse. Analysis, this pattern is mainly caused by transformation of pathogenic dampness into phlegm or by stagnation of chi activity due to emotional depression, which causes retention of body fluids resulting in phlegm collection. Then the heart becomes misted by the phlegm, leading to derangement of mind. This pattern can also result from clearing up of liver wind, which causes rising of hidden phlegm in the heart channel and misting the mind, so the phlegm is sent by the wind to agitate the mind. Key symptoms, there is mental disorders accompanied by phlegm patterns, such as gurgling sound in the throat, drooling, greasy tongue coating, slippery pulse, etc. The table of the phlegm misting the heart orifices. If there is stagnation of liver chi engendering the phlegm, it leads to phlegm obstructing the heart orifices, resulting into depressive psychosis. And here, there is complaint of liver chi, fails to ensure the smooth flow of chi. So there is suspiciousness, depression, apathy. If there is disturbance of the mind, there is dementia, talking to oneself, and there is abnormal behavior. For the disharmony of some organs engendering the phlegm, there is liver wind with phlegm misting to obstruct the heart orifices, resulting in epilepsy. There is phlegm sent by the wind to mist the mind. So there is sudden fainting, loss of consciousness, drooling, gurgling sound in the throat. If there's rising of liver wind, will draw eyes upward and lead to tight contraction of the sinews. So there is upward staring of the eyes and convulsion. For the wheezy phlegm in the throat, is stirring by liver chi rising upwards. There is shouting like pig or sheep. For the phlegm collection in the middle jaw, there is failure to rise, the clear yang, upward, unable to nourish orifices, especially the brain. So there is phlegm syncope, resulting into cloudy consciousness, talking nonsense, unconsciousness. So for the summary, phlegm misting the mind, etiology, there is excessive consumption of phlegm-forming food, severe emotional problems. Underlying or accompanying pathologies, spleen chi deficiency, dampness and phlegm, heart chi deficiency, heart blood deficiency. For the signs and symptoms, there is mental confusion, unconsciousness, lethargic stupor, rattling coming from the throat, vomiting, speech difficulty. The pulse is slippery, tongue is swollen tongue with thick slippery coat, sticky slippery coat. Deep midline crack reaching the tip. For the treatment principle, transform phlegm, open the orifices of the heart, and restore consciousness. Acupuncture treatment, we use Heart 9, which clears the heart, opens the orifices. The other 15 clears the heart, supplements the heart chi. Do 26 consciousness. Pericardium 5 resolves phlegm from the heart. Stomach 40 resolves phlegm. Needle with drainage. Ren 12 supplements spleen chi. Bladder 20 supplements spleen chi. Needle with even method. For the relevant advice, the patient should avoid eating a diet that is damp and phlegm producing. They should ensure that they get a lot of fresh air and physical activity, as there is often a significant emotional aspect linked to this pattern. They should also try whenever possible to address the underlying emotional things. Thank you for your attention.